And thanks to everyone for being with us today here. We have Minister Paul Merriman, Minister of Social Services. He'll have an opening statement, then we will have time to take questions from the line and on the floor. Minister Merriman.
Thank you very much. Good afternoon, everyone. This is an unprecedented time for social services sector in our province due to the COVID-19 pandemic. I have always known that those who choose to work with our most vulnerable are among the most devoted and caring people in our society. Since COVID-19 arrived in Saskatchewan, everyone has and continues to show a level of commitment, compassion, and concern for those in need that is truly remarkable. And I want to begin by thanking all of them from the bottom of my heart. I want to recognize everyone in the Ministry of Social Services across all our divisions: Child and Family Services, Disability Programs, Housing, Income Assistance, and Finance and Corporate Services. Many of them are now doing their jobs from home, and while many are still keeping our offices open and working directly with our clients in greatest need, I thank you. Next, I want to thank all of the third-party service providers, including housing authorities and community-based organizations, many of which have reached out to me to provide suggestions that we have acted on. I've been participating in weekly conference calls with community-based organizations in Regina and Saskatoon, and I've been in regular contact with many of our city's mayors. Our government has been working hard to develop strategies to help Saskatchewan people affected by this crisis, and I believe you will see that in today's announcement. We have been consulting with health and adjusting our responses on a daily basis so we continue to serve vulnerable individuals and families as safely and effectively as possible. We are also in regular contact with other provinces and territories to hear their ideas and solutions. I want to thank them for their cooperation during this crisis. I also want to acknowledge the leadership and support being provided by the federal government. They have introduced several programs and programs enhancements in the last few weeks for individuals, families, and businesses. Anyone who has had their income impacted by COVID-19 should exhaust all federal benefits that they are eligible before applying for social assistance. We have introduced many measures over the last few weeks. For example, we are dedicating the first hour of business in our office to those with a disability or underlying health conditions. We have loosened reporting requirements for income assistance clients, those seeking social housing, and community-based organizations. And outreach and crisis workers continue to be available to help caregivers for people with intellectual disabilities. Today, I'm pleased to announce that the Ministry of Social Services Pandemic Response. This response will support vulnerable Saskatchewan citizens and the organizations that serve them by leveraging existing resources within the system, adapting policies, and allocating new resources. The Social Services Pandemic Response includes measures to provide additional funding to emergency shelters, modifies service delivery models to accommodate capacity pressures due to physical distancing, and the need for clients to self-isolate. The response also includes measures to erase the burden of existing clients as they work within the Ministry of Social Services. Through this, we are providing one-time additional funding of $171,000 to emergency shelters across our province. This brings our total maximum funding for these organizations to over $3.9 million. This funding will help with the extra costs the shelters are experiencing as they continue to serve those in need at this critical time. Together, these 10 organizations provide more than 300 beds for individuals who need emergency shelter and supports. The pandemic emergency shelter response also includes a modified delivery model similar to our cold weather strategy in the winter months to make sure no one is left without a safe place to stay. When emergency shelters are unavailable to meet the needs of individuals or families because of capacity pressures, social services will support those in need with funds for emergency hotel stays and will work to transition clients to permanent housing. Our mutual clients rely on the ministry and our emergency shelter partners to respond quickly to their needs. Such collaboration is more critical now than ever. Those needing emergency help, such as food or shelter, can contact their local service center or their worker. In terms of new initiatives, we will be providing full-time childcare subsidy benefits retroactive to March 1st, 2020, to help families who are getting part-time benefits because their children were attending school. Although not specifically part of our pandemic response, the Saskatchewan Housing Benefit will be open for applications April 1st, 2020. This is a monthly benefit available for eligible households, including seniors, families, couples, and singles. More information will be posted on the saskatchewan.ca website tomorrow. Those are a few of the things that we're doing as part of the social services pandemic response. We will continue to work with our community partners to ensure that any cracks that arise, services are being met. For our clients who are ill and do not have a safe place to stay, the ministry will provide funds for them to stay in a hotel and purchase food and personal items. Once clients no longer need to self-isolate, the ministry will work with them to determine what kind of help they need to be self-sufficient, including referrals to social housing and other services that can help them find longer-term housing. Our government and our community partners share a commitment to supporting the most vulnerable citizens by working together. In the midst of this unprecedented time, it is even more important than ever that we communicate often to help each other in order to better support those we serve. Thank you.
Thanks very much, Minister. We'll start with a question from the line. Operator?
We have Zach Vicera with the Star Phoenix. Hi there. Can everyone hear me?
Yes.
Wonderful. Minister, you mentioned that this is a one-time funding boost of $171,000 for every shelter listed. Looking at the Lighthouse's budget, that's something like 3% of the Lighthouse's annual budget. Mm-hmm. Is that enough money?
What we have with all of our organizations is we have built into our contracts a stable side of the funding for any emergency shelters. 50% of the contract is paid up front, so we cover off their overhead costs. After that, it's done on a per diem. This is something that we have determined that will cover off a lot of their cleaning supplies and that, and be able to make sure that the clients that are at the Lighthouse are safe.
Do you have a follow-up, Zach?
I can ask a follow-up.
Yep.
The release mentions that you're looking to house people who need to self-isolate, potentially in Saskatchewan Housing Corporation units. Mm-hmm. Can you say how many available units or vacant units there are in Saskatoon, Regina, and Prince Albert, our three largest urban centers, respectively?
In Saskatoon and Regina, we have about 375 each. I'm not sure on the Prince Albert number, but we do have about 2,900 chronically vacant units throughout the province. So we do have some resources that we can use there.
We'll take our next question from the line. Operator?
We have Creedon Martell with CBC.
Hi, this is Creedon Martell here with CBC. CBC has heard from, we've talked to some of these shelters over the last week about some of the problems going on. And we've been hearing today that, some of the stakeholders, I guess you would call them, are quite upset that, they say this payment will basically only possibly cover the month, even if that are there any more supports that they can expect, or that they have access to them right now that they may not know about? Or what's your advice to these shelters who feel that they're kind of, trying to keep their heads above the water?
I did receive a report on Monday about the shelter usage. We did have some overflow of shelters. We had 4 in Saskatoon that we had to place in hotels, and I believe there was around a dozen in Regina that we had to place in hotels. Again, we want to make sure that the shelters have enough for their operating costs, which is that 50% of the contract. So in the case of the Lighthouse, we would pay that up front just to make sure that they are kept whole during this time, and then we would pay on a per diem basis on going forward.
Do you have a follow-up, Creedon?
No, I don't.
Great. We'll take our next question from the floor. Steph?
Yeah, how come there's nothing in here about a walk-in testing location for those who are street involved or homeless who say don't have access to a computer or phone? Both of those pieces of technology are pretty important when it comes to accessing the 811 health line, and just doing the online self-assessment tool to see if you even have COVID. So why not walk in?
Well, in that case, if somebody walked in and was presenting with symptoms of COVID, we would ask the shelters or them to be contacting their caseworker at social services so we can assist them with that process and get them set up with appointment. If there's an opportunity for them to be taken to that appointment, we would try to make arrangements with the shelter at that time.
So what's the process in your mind if you're a homeless person in Saskatchewan and you don't have access to technology or doctor's offices? How would you even go about seeing if you have COVID?
Well, there are lots of our community partners out there that would help them access. I know the Salvation Army is specifically helping individuals. In Regina here, Street Culture is helping them access the internet at some of their shelters for them to be able to do that self-assessment. And if they do present, then we would ask them to either call 811 and book their appointment, just like anybody else would. And we would ask the shelters and any other community-based organizations to assist them with that process.
There's been asks for personal protective equipment, namely the N95 masks for people at the Lighthouse and all of these different shelters working with folks on the front line. Are they getting those supplies? Have you committed to giving it to them?
Well, each shelter is, again, the government doesn't operate those shelters individually. We have within social services some PPE for our child and family people that have to go in and do investigations in that. But we have heard that there are some extra costs in that, and we're hoping that this $170,000 will address some of the costs that they might need within their shelter.
We'll take our next question from the line operator.
We have Allison Bamford with Global.
Hi there. I've been talking with YWCA Regina, and spring is usually their busiest time of year, and they're often turning away at least 200 women and children per month from their shelters. I'm just wondering why only one of their shelters out of the two here in Regina are receiving this funding.
If there is a shelter that was not under the contract with us originally and needed some of that support, I would ask them to contact our office, and we will connect them in to our income assistance director and provide that service for them as well. We want to make sure that all shelters are covered during this. If there are some that aren't, I know in Regina, there are a couple of shelters that are covered, but we're making sure that the ones that do have this, and I just check my notes here on which ones we are covering in Regina. There's my aunt's places in Regina, and we also have the Salvation Army in Regina and Souls Harbor in Regina are covered. Those are the ones that we have current contracts with, and if there are other ones out there, I'd ask them to contact our office and we'll work with them.
Do you have a follow-up, Allison?
Yeah, just further to, I think it was Steph's question on just not a lot of access to internet or phones for a lot of these people. A lot of the WISE supports are online, and now that libraries are closed and the WISE closed its door, lots of people don't have access to computers or phones. Is there going to be something more done with that?
Very good question. That was actually brought up this morning from one of the Regina areas of having an increase of their internet access within their shelters. And it's something that I'd certainly like to bring up with the Minister of SaskTel to see if there are some opportunities that we can boost that capacity in there, but also making sure that if there is a shelter out there that does have online access, that they give an allocated time to each individual to be able to access any of the services that we have in social services or any of the other programs that are out there.
We'll take another question from the line operator.
We have Allison Sandstrom with PA Now.
Hi, can you hear me?
Yes.
Okay, great. My question is about the cold weather strategy and how that's going to work now. So I'm just wondering about the practicalities of social distancing inside shelters. So for example, in PA, we have an emergency shelter with 30 beds. Does the capacity there now become 15 beds and another 15 people have to go to hotels? Just how that works around keeping distance between people to avoid transmission.
Thanks for the question. In any specific shelter, I would leave it up to the organization to make sure that they're doing the social distancing. I know shelters are going to have to reduce their capacity, and that's why we wanted to make sure that we had an overflow into the hotels temporarily until we can find them some permanent home. But we want to make sure that that if there is capacity in there, that they're still maintaining the social distancing that our Chief Medical Officer has outlined for everybody.
Do you have a follow-up, Allison?
That's it. Thank you.
Perfect. And we'll go to the floor for last question.
Minister, $171,000 isn't a lot of money for 10 shelters. The Government of Alberta provided $30 million for homeless shelters dealing with COVID-19. So why such a small amount of money?
This is, again, their structure on their funding of shelters is different than ours. I'm not completely familiar, but what we do is that 50% of guaranteed funding up front, and then it's done on a per diem basis. This 5% or $171,000 lift overall is to deal with any of the cleaning supplies that they have. But they will also probably have, if they are social distancing, they will have reduced numbers in the shelters. So again, we'll still continue to pay them on a per diem basis.
Again, so would you be willing to give them more than the 171 if they come to you and say, Minister, this isn't working, we need money for more cleaning supplies or more PPE, would you be willing to go higher?
What we're looking at is, that's why I'm having constant weekly calls with all of the shelters. I just had one this morning with Regina. I'm going to have one this afternoon with Saskatoon and the major centers, and also talking to the city mayors to find out what are they hearing. They're kind of my ears on the ground. If this is what we have right here, right now, and if there's a continue ask, then we would have to evolve that with what we're seeing. We're also asking the shelters to report into us on a daily basis as to what are their capacity, were they at capacity last night, and how many they referred to hotels. So this is evolving as we speak, and we want to be able to continue to hear their needs. So if we have to evolve, we will certainly have those discussions with them.
Great. Thanks so much, everyone. That's all the time we have for today here.